Welcome to the Hypertension Canada at Target program. This video will provide you with a brief overview of the program. This program is designed to determine levels of knowledge and attitudes towards Hypertension Canada guidelines, measure the uptake of the guidelines and attainment of blood pressure targets in primary care settings, provide evidence-based learning with the goal to improve guidelines adoption and adherence. Your participation will involve a total of 8 steps. Each of these steps, with the exception of the WebEx results review, will be completed on the VivoMap platform. The first step was to sign the online participant contract, which you have already done. The second step is to watch this overview video. The third step is to complete a one-time practice profile questionnaire regarding demographics as well as perceived practices and baseline knowledge. The fourth step is to view a short clinical video featuring the latest updates from the Hypertension Canada guidelines. The fifth step is to complete 10 to 15 retrospective chart audits for your eligible hypertensive patients. Further information regarding inclusion criteria will follow. The sixth step is to receive a personal report of your aggregate program results in comparison to the aggregate results of all program participants. The seventh step is to participate in a 1-hour WebEx meeting to review and discuss the program findings. This will take place in early April. The final step is to complete a short reflection survey regarding your learnings from participation in the program. A professional honorarium of $400 and complimentary 1-year membership to Hypertension Canada will be provided for your participation in this program upon completion. Chart audits may be completed for patients who meet the following inclusion criteria: prior diagnosis of essential hypertension with blood pressure measured and recorded in chart within the past 6 months, or previously not diagnosed with hypertension but fulfills the following criteria: at least 50 years of age, has had most recent systolic blood pressure of 130 to 180 mm mercury recorded within the last 6 months using an automated office blood pressure device, and one of the following: clinical or subclinical cardiovascular disease other than stroke, chronic kidney disease excluding polycystic kidney disease with an eGFR of greater than 20 to less than 60 milliliters per minute per 1.73 meters squared, 10-year risk of cardiovascular disease of 15% or greater on the basis of the Framingham Risk Score, 75 years of age or older, and does not have any of the following: history of stroke or TIA, residing in a long-term care facility, symptomatic orthostatic hypotension, type 1 or type 2 diabetes, proteinuria greater than or equal to 1 gram per day. An objective of the at-Target program is for at least 50% of enrolled patients to have either diabetes or fulfill the high-risk criteria with or without prior diagnosis of hypertension. The high-risk criteria are highlighted by the red box. The patient exclusion criteria are as follows: patients who, in the opinion of the physician, have severe comorbidity impacting blood pressure management, patients with known secondary hypertension, patients with an eGFR less than 20 milliliters per minute per 1.73 meters squared. To allow you to track the patients for whom you have completed a chart audit, a Microsoft Word patient tracker template is available for download. The template can be downloaded from the Resources tab on the At Target program homepage. Upon starting a new chart audit, the platform will provide you with a patient identifier, 1 to 15. Open the Word document and enter the patient's name or chart number beside the corresponding patient identifier. You may wish to use this tracker to identify certain patients for follow-up or add any additional comments. Please print or save this document on your desktop for easy access. Upon completion of each chart audit, you will be provided with a summary of the patient information you have entered. The summary will include information such as age, gender, current hypertensive treatments, and whether the patient is achieving blood pressure targets based on their risk factors. You will have the option to download and/or print a PDF version of this summary for your records, or to save in the patient's chart. The At Target program was developed by Hypertension Canada and the collaboration of Dr. Alan Bell from Toronto, Ontario, Dr. Swapnil Hiremath from Ottawa, Ontario, and Dr. Ross Suyuki from Edmonton, Alberta. Please note that VivoMap is accessible via computer, tablet, or smartphone. To ensure an optimal experience, we highly recommend that you use Google Chrome to access the VivoMap platform. Other options include Firefox, Safari, or Internet Explorer version 11 or above. For any questions or technical support, please email Ashley Folkard at afolkard@ctccom.com or call 1-800-561-7516 extension 2235. Thank you. You may now begin your practice profile.